Physician's plan is very unique from our competitors for a few reasons. One, we do take the time to get to know our patients. When patients walk in and make that first appointment, number one, we want the patient to feel comfortable. Number two, we make sure that we really talk to them about what the patient's goals are, what their struggles are. Everybody's unique, so we're not just a one-size-fits-all type program. So we really like to listen to the patient, feel like what they're struggling with. We can have patients that come in that they want to lose maybe 10 pounds, maybe they need to lose 100 pounds. So we are unique that we take the time to get to know the patient, that they're comfortable with us, and we really want to help them through their weight loss journey. So what we do on initial visits with our new patients, basically when they come in, we're going to go into our weigh-in injection room, and we're going to get a body comp, which is a printout. The patient gets weighed, it gets their body fat percentage, it also gets their BMI calculations. So we're going to do that, print that off for them, and we walk them through the whole process of what's going to happen next, which is get a blood pressure, we take measurements, and then we talk with them about the injections. With our new patients, we do encourage them to do the B12 lipo injections. Our B12 lipo injections, what we do is basically talk to them about how often they do the injections, which they get a month's supply as a new patient, which is 12 injections. So you're going to do 3 injections a week is what we recommend. Like a Monday, Wednesday, Friday, or a Tuesday, Thursday, Saturday is the kind of the routine. With the injections, B12, B5, and B6 is in the injections, so that helps with their energy, overall well-being feeling. It can help boost your metabolism, and it also helps aid in your immune system too, especially if we have a patient or myself that feels like I'm getting sick, it's the winter months, flu's coming, do a couple extra injections to kind of boost your immune system. But also with the B12 injections, the lipo part of the injection is breaking down the fat in the body. So it helps break that down, which aids in weight loss, and then it also helps speed up the metabolism. So once we go through the injections, get the body comp measurements, blood pressure, we'll take the patients to the nutritional counseling room. In there, we sit down and really, again, go over what their goals are, their struggles are, and we put a plan specific for them together. So we're going to talk about what to eat, how to eat. In very depth, go into detail of why I set them up on certain calorie range, a certain protein goal. We talk about sugars and what that should be. We go over eating. What the typical day would look like, how often they should eat. And then we do talk about, incorporating some of our products in with their everyday foods. We think it's very important that this is a lifestyle change, so something that you can do to lose weight and then also keep the weight off. So this is not a fad diet or something that they're going to do for 2 or 3 months. This is that lifestyle change where they lose weight, but then we give them all the tools so they can keep the weight off. We do talk about products, which as you see, we have tons of different products. Anything from shakes and bars, chips, all kind of drinks and things like that that you can incorporate in, again, to the everyday foods. A good thing with us, we do have multiple locations. So with our locations, having 7 offices, we all really have to mutually agree that, the certain products that we'll carry. For instance, we might have 5 different chips and maybe we carry 3, but for the most part, whatever we carry in any of our offices has been tested with all 7 offices, and we have to get that approval. So we don't have, the biggest thing that we say is to the patient, try this, sample this before you buy it, because we really feel we have a lot of good snacks and meal replacements that each patient can find a few things that they like and enjoy. Another thing, with us, these are easy things that are on the go. We can put a plan together for the patients that they don't care. They don't want to take the time to meal plan and prep. Let's do a fast plan. And basically that's going to consist of, let's let them sample some foods and we'll get an idea, of what they like, and we'll put a plan together for them. So, here are your breakfast items, here's your snack items, here's your lunch, and then really the only thing that they're doing on their own is a dinner, which is a simple protein. It could be a chicken, fish, shrimp, salmon, something like that, and then just maybe a vegetable, a salad, and it's very easy. So we try to take the struggle of not wanting to meal prep, to some people love doing that, and we can help with recipes and give them ideas as far as that too. So in a nutshell, a new patient is going to get really that handheld service with us. We do want to get to know you, who you are, what's your lifestyle like, do you have kids, are you just coming in to lose those 10 pounds for an event coming up like a cruise or a wedding or reunion, or again, this may be a lifestyle change. So I feel like we have the tools here and give the tools to the patient, where we can help them for as long and as much often as they need it.